Ain't No Half Steppin with Marcus J. Thank you for staying with us and listening to the flagship show, heard right here, live in the den, LegacyInternetRadio.com. We got some new listeners. I'm seeing the posts that we're getting on the Legacy Internet Radio fan page and the Ain't No Half Steppin with Marcus J fan page, as well as everything that we're getting in MixLR. So we appreciate the love and appreciate everybody listening to us. Definitely make sure if you need to leave, you can't stay at the computer, check us out on TuneIn. Just go to TuneIn, the application on your smartphone or your iPhone. Download TuneIn, search LegacyInternetRadio.com, save it. There you go. Any of the programming that we have here, Monday through Saturday, you can get us mobilely. So stay with us here at Legacy Internet Radio. We appreciate the love. We appreciate the support. At this time of the show, every single week, we always profile a missing and or exploited child. This child we're getting from blackandmissinginc.com, this young fella by the name of Avante Akendo. I've been seeing this fella all over social media since he went missing on Friday, October 4th. His date of birth is January 1st, 1999. He's a black male, medium complected, 5'3", 125 pounds. He's got short hair. He's missing from Queens, New York. Now, what's special about this young guy is that he suffers from autism. He has the mind of a 7-year-old, and he is mute. And so if he's out there and people are trying to help him, he may not know how to respond. He was last seen leaving the Center Boulevard School in Long Island City around 12:45. Surveillance video shows him simply running out the door. He was wearing a gray striped shirt, black jeans, and black sneakers. Once again, Avante suffers from autism, and he is mute with the mind of a 7-year-old. So please keep your eyes open for him. Contact the National Center for Missing and or Exploited Kids at their website, missingkids.com. Contact blackandmissinginc.com or contact the National Center for Missing and or Exploited Children by phone at 1-800-THE-LOST, 1-800-843-5678, or contact your local authorities. Queens, New York, my family back home in Jersey, Connecticut, the whole tri-state area. Keep your eyes open for this young brother. Ain't No Half Steppin with Marcus J. Let's find out missing. All right, it's time to move on to our healthy segment. And this week, this month, we're focusing on the healthy lady because we know this is Breast Cancer Awareness Month. So hopefully everybody's got their pink on. And so it's time for SY to take the mic and take the floor. My sister, what you got, girl?
Well, I got a few things. It is Breast Cancer Month, like you said, but I'm going to touch first on something that we got to a little earlier, and that's depression. I'm going to talk to pretty much postpartum depression. During my research, there's really not a lot that differentiates postpartum depression from depression, other than the fact that there's a baby involved. So I'm going to go through some of the things I found. There's a website I'm going to give you, just some signs to look out for. There's really not much that we can do other than trying to get help for the person who's affected. There are a few types of postpartum depressions. There's the postpartum depression, and then there's the baby blues symptoms. And the first thing I'm going to give you are the signs, especially when there's a baby involved. We're having mood swings, anxiety, we're sad, irritable, we're crying, we cannot concentrate, and we have trouble sleeping. And like I said earlier, it kind of blends in with just depression, period. So the biggest difference here is that we have a baby. And there's a lot to take into consideration because usually you're just very happy, you're having a baby. This is a great time. You got all these great things in your head that you're going to do, playing in the park and all this good stuff. And then the closer you get to maybe having the baby, oh my God, I'm responsible for this child's education. I'm responsible for this child's health. A whole bunch of things come into play. Now we have the baby, and there's this constant crying. Why are you crying? You won't stop crying, and you have no idea what that person is feeling. So you might want to monitor some of those symptoms. Postpartum depression, it may seem like the baby blues at first, but the signs and the symptoms are a little bit more intense and they last a little bit longer. We have a loss of appetite, again, the insomnia, irritability, anger, overwhelming fatigue. There's a loss of interest in sex, lack of joy for life, feeling some sort of shame or guilt, severe mood swings, difficulty bonding with the baby, big clue, withdrawal from your family and friends, thoughts of harming yourself and the baby. Now, withdrawing from the baby, that's a major, major clue. If you don't want to be bothered with the baby, or you notice that the mother just doesn't want to have any interactions with the baby, won't get up if the baby's crying, you change the diaper, I hear it crying but I'm not moving, any of these things, you definitely want to start to monitor this person, pay attention to the symptoms, and possibly start seeking out some help ASAP. There's also, which is more severe, and they say the condition is rare, but it's more severe, and it does exist, postpartum psychosis. There's confusion and you're disoriented. Hallucinations, delusions, paranoia, and then the attempt to harm yourself or the baby.
You know, when we talk about postpartum depression, one of the first things that comes to mind when you talk about the psychosis with it is the Andrea Yates case, which was the Texas woman back in 2001, I believe, who she drowned 5 of her children. She killed them. She drowned 5 of her children, and, you know, postpartum depression was a large part of it. And we also have been given information about the Miriam woman in Miriam, what's her name? Carey in D.C. this past week. Her family alluded to her having issues with postpartum depression, which is it's a good time to be talking about it now. It's in the news. Let me ask you this: do you have any information there, either there in your paperwork there or in your knowledge of how long, worst case scenario, something like this could affect you?
Or, well, it can start anywhere from right after the baby's born. It can last for years if it's not watched appropriately. If you notice any of these signs last more than 2 weeks, you definitely need to go and seek help. There's actually a link on the CDC for a little quiz that you can take. Anyone can take it to find out, put in their symptoms, and then depending on your outcome of that quiz, it'll let you know whether or not you should seek help. If the symptoms get worse, seek help. If for some reason it's complicated even for, let's say, the other parent in the house to take care of the baby and mind the person who's not well, seek help. Personally, it is very true, postpartum depression, and it has the difference between it and regular depression is the baby. We got that already. It put me personally in a position where I definitely needed somebody to watch my baby because I was just tired, and there was just so much attention that she needed coming home.
Now, let me ask you this: as far as the depression that is being suffered by the mom, what kinds of things can her support group do to assist with it? That support group being hopefully her husband or the child's father, whoever she has as part of her camp. How can we help, a sister who has postpartum depression?
What you need to do is be there as soon as you see any symptom. Help take care of the baby. Help mind the mother. Little things like, I'll do that for you. Just sit there, conversation. Just anything that kind of helps relax the person from thinking that the world's about to come to an end, I have to deal with this right here.
Right.
Help take away some of the work that's involved in taking care of the baby when the baby first comes home. The mother's tired. The mother's really tired when she first comes home. And now you don't get time to stay in the hospital. Yeah. You have the baby. Tomorrow you're packing up.
Yeah.
So you really do need that time to just kind of relax. The body's going through a change. Just relax. Somebody, help take care of the baby. Let the husband, the dad, the grandmother go ahead. You go ahead and relax. Become one with knowing now you're this great new parent. And let them just help you out. So that's what you can do to help out.
Now, as far as incidences like Miriam Carey and Andrea Yates, I mean, my guess is, most moms don't run out and do something crazy like those two ended up doing. But I agree that there needs to be some support, some type of support there. Is there any kind of information that says, percentage wise, how many people are affected by this?
15%, anywhere from 10 to 15% of women are affected by postpartum depression. And there's a greater chance of it being 15% if there's any type of depression that person has gone through prior to having a baby. Any type of stress in the home, whether there's a husband and wife bout going on, anything that causes any stress can definitely increase your percentage for postpartum depression.
That's scary. That's real scary.
Very.
15% more of that also goes into the level of psychosis as well.
So once you get to 15%, once you get that whole number, 15% of that number
transfers to psychosis. About 2 out of 1,000.
You definitely need to be seeking help in that 10 to 15%. You need to be seeking help.
Now, who diagnoses it? Now, I mean, is it, and again, keep in mind, as a guy, we oftentimes can be oblivious to some of the challenges that a woman can have. I'm certainly aware of my blindness to it from time to time. Who diagnoses it? Is it her saying something ain't right? Is it the family member saying something about you ain't right? I mean, is it I don't like my baby and I'm supposed to like my baby? I mean, like, how do we know that we even have it?
You've got to pay attention. You've got to pay attention to the signs. Now, you go back and you see your doctor, your OBGYN or whomever. You go back because you're taking your baby to the doctor. You have to go to the doctor yourself. And they talk to you and they ask you how you're feeling. And if you're honest, or the person that's going with you will say, she doesn't even want to get up, and the baby's crying, I work nights or whatever, I come home, the baby's still wet, the baby's crying, she's just laying in the bed, then what they'll most likely do is refer you to a specialist who will talk to you more and try to help work through it with you.
Do we have any more on postpartum depression?
Let's see. The Center of Disease Control. They actually, if you go to their website, there is a link there. I'm going to post the link for you. You can click on the link. It leads you to a lot of information. It leads you to the quiz to take. And like I said, anybody can take the quiz. The husband can take the quiz.
Right.
It's all about you putting in the signs or the symptoms or anything that you think may be off.
Right.
And the hardest part again is you have to pay attention, because if normally she's always mood swinging, or she's always uptight about this, that, and the other, you have to pay attention. Now there's a baby involved, and is that baby being affected? So you definitely have to pay close attention.
Okay. Well, fellas, I mean, that's not something that we're always real good at, and I know that a lot of our Ain't Steppin Marcus J listeners, a lot of our listeners to Legacy and Net Radio, are younger people, 20s, 30s, which those are the prime years for having children. So, ladies, if you feel like you might be someone that's a candidate for this, be honest. Don't feel like you got it all figured out. Be honest and talk and share. I know oftentimes we don't feel like we want to talk about what our situation or what our feelings are, but this is a situation where it ain't really even about you anymore.
Not
because
at all.
With the child involved, your behavior with regards to taking care of the child can have detrimental effects.
You can't do it all. You can't do it all by yourself.
Yeah.
So.
I have Steppin with Marcus J. All right, so we got something else that we want to talk about during the healthy segment. Of course, with this month being Breast Cancer Awareness Month, we definitely wanted to kick it off by having a conversation around that. So why don't you share with the listeners what we got?
Just a few tips on making sure you're healthy, protecting the tatas, and
because we love the tatas, y'all.
I know you do. I know you do.
Love them things.
So just a few tips on how to help. Unless this is something, because I don't want to make this seem like this is how you prevent it, because this is not how you prevent it. Because if this is something that runs in your family, you definitely need to go and get yourself tested. You definitely need to do your self breast examinations as well. But just a little bit of things that you can help do to just keep your overall health good, because some things can lead to other things. So you want to make sure you get at least 4 hours of exercise a week. And I'm going to post this as well. You want to make sure that you get at least 4 hours of exercise a week. You want to keep a healthy weight, especially after you hit menopause, because your weight is harder to come off. So you want to make sure you eat healthier, get those greens in, and limit your alcohol intake. I don't want to say if you have to have a drink, but if you absolutely must have a drink, one is the number.
Just one.
Having children after the age of 35, you want to make sure you speak to your doctor on that. You want to make sure there are several tests that you have to go through, and this is not to go into details with all the testing that you may have to go through, but there are testing that you'll have to go through. And not breastfeeding after you have the baby. Those are also one of the things they want you to help do.
So they want you, okay.
They want you to actually breastfeed.
Oh, okay,
the breast milk is supposedly healthier for the baby.
Definitely for the child. What about mom?
It's not harming mommy in any way, shape, or form.
Okay.
Family history, again, if this is something that runs in the family, relative with breast cancer or ovarian cancer at a young age, you want to watch out for that and make sure that you're going and being tested as normal. And I believe we posted a chart on when we should be going to the doctor.
Now, I know that, testing, home testing is, and I know you got a lot of stuff, and I like to skip around, and if I cut you off, we can come back to it. But I know that the home testing is kind of like the first line of defense, ladies, and you can get your man to help you out, and you can even, I'm not trying to be crass, I'm just real talk.
That's not going to work.
You can teach him what to feel for, as far as, and I'm brainstorming. I don't know these things, but some people feel uncomfortable doing that, searching their bodies for things of that sort. And so if you have a partner there to help you, and I think I heard it said that you're supposed to do this after your cycle, like a week after your cycle or something like that. You're supposed to test yourself.
You can test yourself at any time, though.
Okay. Okay. Well, anyway, if you are doing it and you're getting help doing it, isn't that helpful? I mean, you tell them what to look for.
It is helpful, but here's the thing: you've got to know how to move and manipulate in between your glands, and you're gonna know how to feel for that. I just don't know what to do with him. Y'all can't see it, but Ruben's giving himself a self-examination.
Hey, why not? You got to check. Hey, Richard Roundtree had breast cancer.
Yeah, I'm getting ready to say.
Shaft
Y'all
had
laughing.
to protect the tatas, okay?
I mean, I like mine.
I'm going to read something that I just noticed. Changes in your genes, the BRCA1 or BRCA2 are possible signs. And these are human genes that produce tumors.
Genes?
Yes. So you definitely want to go and get yourself checked out. You can Google it. You can look it up. CDC also has information on that. BRCA1 versus BRCA2.
Now, we know that history has a large determining factor as to who's going to get it, your history. What do you say to people who just, aren't taking, it serious, or they're afraid, or that kind of stuff? And then what do you say to those people?
Don't be afraid. Don't be afraid. If it's in your history, you definitely need to just go. Doesn't mean it's you, but you want to make sure it's not you. It's better you find out sooner than later, and not much can be done later. So don't be afraid. Go get your mammogram. Do whatever you need to do. Get them under that little machine and make sure you're okay.
Yeah. Machine, huh?
And that sucker is a crusher.
Yeah.
And I can tell you, it really does come down, and it's really got to come down to get me. So it's
you get that one tear that balls up in the left corner of your eye.
Yeah, you're like, somebody get that fire from up my pupils. But you just want to be careful. Radiation is another thing you want to look out for.
Radiation. Now, where do we get radiation?
Anything in the chest area. If you have any work done that you may have had some type of radiation treatment.
Okay.
You also want to make sure that you're getting yourself tested.
Isn't that why they put that that lead thing on to cover you up when you go to the dentist, when you're getting like what you call X-rays?
Yeah. Yep, cover you up.
Yep. Okay.
So I'm gonna post it. Definitely read it. Definitely look into it. There's a lot of information you can find out on how to keep yourself healthy, how to remember to go and get yourself checked.
It's a scary thing, and every single month, as guys, we're not always on the forefront of knowing about it and such. And I would guess a lot of guys realized it was Breast Cancer Awareness Month, watching the games yesterday and seeing the pink flags and all the pink scarves and all the pink towels and things of that sort. But the reality is, fellas, if you want your lady to be around, then you need to encourage her to get herself tested, and if she's afraid, then go with her. And if she needs help self-examining herself, then don't try to make it about filling her up. Like, seriously try to help her out, things of that sort, because we all want to be here. And if we're not here no more, we want it to not be here no more because of something that's preventable. And this is something that you can try to stop it in its tracks if you catch it early enough.
And I want to touch on one other thing very important: hormone replacement therapy. Some types of replacement therapy does increase the risk of breast cancer, and it can cause dense breast tissue, which makes it harder for when you have your mammogram for them to find if there is anything that looks abnormal.
Now, we just used the politically correct term, but if I'm understanding you correctly, we're talking about transgenders, right?
No.
We're not.
No, we're not.
Okay, so that's so I misinterpret.
Example.
I misinterpret, because when you said what's the phrase?
Hormone replacement.
Hormone replacement. See,
therapy.
when I heard that, it sounded like someone who is transitioning. So I was wrong. So it's possible that one of the listeners might have gotten confused about that. So why don't you explain what that is?
You can also going through menopause. There are different types of treatment depending on how you want to be treated, where you're treated, that can kind of level off your hormones to take away your symptoms. All right, that's included. So you want to be careful that if you're doing this, that you're definitely going to get checked. If you have a mammogram and your results come back to you saying that you have dense tissue, you absolutely positively must follow up with your doctor ASAP, because it just means we can't get a good picture. we don't know if there's anything there or not. We need to work on getting a better shot of your breasts. So.
Just add 3 quick things. One of the things the women need to check out, especially when you're dealing with certain men, especially those who are athletes. I'm not casting this on everybody. Those who do hormonal things for the lifting weights, or let's say their hormone replacement to get their knees and joints fixed, they circle. It's not approved here for the U.S. for a reason, but it's approved overseas. So you see a lot of them going overseas getting the blood mixed with their hormone treatment, injected in the bones. So if you didn't have anybody that's going to do that, or doing the weightlifting, powerlifting, football, anything that's taking a lot of that stuff, you really should get that checked out with the guy. Test. And that's where it goes along the line of getting your BRC 1 and 2 checked with the DNA matrix. Another thing that you want to do now that I've been encouraging for, not just for baby, but even for future, for your children's baby, or even for your health, when you talked about the postpartum, the cord blood storage.
Okay.
And the reason being is not, it'll help for stem cells or studying the medicine for other people, but also for your child. And then that way, along with the information from your DNA matrix, okay, heaven forbid, you can understand maybe ahead of time your child may have some problems, or when she gets ready to have a child. For example, let's say you got it, and then your child got it. So now you have more information between the cord blood, and both of you have your DNA matrix. So you can make an informed decision. Right. I'm not going to tell any woman not to have a child. Let me rephrase that. I just had a friend of mine, Tashima Potts, came in a couple of weeks ago. If she had did this, she would have probably thought a little bit more about how she treated her body, because it added with the weed, the drinking, the drugs, all that other stuff added, and that lowers those BRC counts. And then they're looking on more. The DNA, they still studying. So that's where you have to understand that those are the 2 things that was identified some years ago, that you need to check all this out. Myself, I have take medicine for a variety of different things, but I've done my DNA matrix, so that way, Lord willing, I do have a child. I need to think about it soon. But if I do, I want that same health information for her, for her standpoint, because I don't want her to die doing the pregnancy.
You want to know what you're up against,
and I know what I have to do for myself.
Yep. So that's pretty much it. I'm also going to just point some healthy tips for your skin, let you know to stay away from too much junk food, eat your fruits, drink your water, and I'm going to put like a 3-question quiz up there for you and see if we can get some answers. But that's pretty much it. I'll post all of this, and I'll also post that link for postpartum depression.
And Steppin with Marcus J. Thank you so much, SY, for leading us in the healthy segment. Every single month we get a nice rotation of the healthy, the wealthy, and the wise, and this week was the healthy, so we'll see what we get from you next week. We appreciate it. It's time to take another break, and when we come back, we got Big Rube. Big Rube's going to lead us in his segment called The Roundtable. SY, Steven Sykes, Mr. LP, Big Rube, Marcus J, and you, the listeners of Ain't No Half Steppin' with Marcus J. Stay with us.